Hello, Dr. Jones and everyone. My name is Edwina Garnett. I am a graduating senior at Coppin State University, majoring in social work, and I will be sharing some valuable information about the agency where I serve for field placement, and that is Project Place Homeless Shelter. And so I will begin with an introduction and background. And so 7,144 people in Maryland experience homelessness on a given night, and 12 are homeless per 10,000 people in the general population. Although there is a growing number of homeless people in Baltimore City, there are combative forces such as nonprofit organizations and the government financial support working to reduce homelessness. Project PLACE is one of those organizations that addresses homelessness by providing temporary and permanent housing and supportive services to homeless adults and families. The organization serves the most vulnerable and underserved, including persons with mental illness, HIV and AIDS, addictions, developmental disabilities, and ex offenders. The organization treat, restore, and rehabilitate the whole person and empower everyone to function at the highest level possible. So, Project Place um, was founded by Frank, Miriam, Eric, Gregory, and Mary to remedy the lack of housing and resources available to Baltimore's homeless citizens. Originating as a walk-in center for those experiencing homelessness, Project Place opened its first housing facility in 1978. It now has two temporary housing facilities and is in the process of converting an old elementary school in Irvington, Baltimore, in 88 permanent and temporary affordable housing units. The zip codes of the agencies are 21201 and 21229. However, they assist clients that are from different parts of Baltimore City and the state of Maryland and also other parts of the world. The population served at Project Place are a mixture of Caucasian, Korean, Asian, Alaskan, and mostly African American. There are women, men, and transgender people, including veterans, people with HIV and AIDS, mental health, substance abuse issues, and physical disabilities. The awareness of diversity and difference of practice is mostly shown in the four programs that Project Place has, and also through their collaboration with outside agencies um, and other organizations that they collaborate with to make a difference in the lives of the population, of the homeless population. And so, as mentioned earlier, there are individuals there with that are veterans, HIV and AIDS. Some have substance abuse issues. Some have physical disabilities. And so there are different treatment plans and different programs to treat each individual. And so that is the way that they show difference of practice and also awareness of diversity. The community resources, there are much more community resources, but the main resources that are utilized by the population and also the agency is the Maryland Food Bank. Um, and Project Place, they have monthly food pantries where they serve food to the community, and the shelters also provide 3 meals a day. And so a lot of the food is donated through the Maryland Food Bank. Also, there's Maryland Department of Human Services and Department of Veterans Affairs that also assist this population with a variety of services such as food stamps, medical assistance, health care, um, and also I would say resources for income. Also, there's the mayor's office of Emergency Management that also provides funds for permanent housing and temporary housing services, and also the health care for the homeless. And so, when you talk about social and economic injustices that Project Place tackles is, one of those things is social isolation that is also caused by substance abuse, family distancing, and mental illness. And some of the structural forces are lack of available low income housing, poor economic conditions, food, physical, and mental health disparities. And so these are two of the policies um, that impact Project Place, and that is the continuum of care and the Ryan White title. The continuum of care is a program designed to promote community commitment to the goal of ending homelessness and offers to fund nonprofit providers, state and local governments to rehouse homeless individuals and families quickly. The Ryan White title is the Health Resources and Services, that is the most extensive federal program explicitly focused on providing HIV care and treatment services to low income people living with HIV who are uninsured and underserved. Ryan White fund grants to city, countries, states, and local community based organizations such as Project. And so the other two policies that are state and national policies that impact the homeless population are the Stuart B. McKinney Vento Homeless Assistance Act and the Fair Housing Act. And so the Stuart McKinley Act is a public law that authorizes the use of unutilized public building and real property to assist the homeless and to make the surplus personal property available to nonprofit agencies. Um, the Department of Housing and Human Development administers 5 individual homeless assistance programs following the McKinley Homeless Assistance Act. The Fair Housing Act is a law created to help limit discriminatory practices related to landlords, tenants, and housing. The act was built on the principle that every American should have equal opportunity to seek a place to live without being afraid of discrimination due to factors outside of their control. The recidivism rate at Project Place is about 10 to 15% of those who leave the shelter return. Um, that low recidivism rate is a plus because it means that they know the resources better and may be more ready to utilize the behavioral health and housing resources fully when they return. In general, there is a substantial and growing body of evidence supporting the effectiveness of permanent supportive housing for improving the housing stability of individuals. Studies have consistently shown that 2 year housing retention rates in permanent supportive housing are above 80%. The success rate at Project Place is 90 to 95% of those retain housing. 87%, I'm sorry, 87 persons were housed and supported to remain housed through this grant. Of the 30 families housed, Places staff members were able to assure that all clients with children gain and maintain custody of their children. The organization reported this year that 9 clients plus 2 family members are employed. All clients who are unable to work have obtained disability benefits. I had have had the pleasure of being trained as a case manager. That was my role. My role was to shadow a employed case manager, and I worked with 2 clients weekly on a weekly basis to have one-on-one sessions just to check on the process of clients obtaining personal um, and also permanent housing their status. And so it was my job to assist with any help towards substance abuse treatment, referrals, I would say therapy, referrals, and also to help clients obtain any related documents that were needed for them to take the next step into their process with obtaining housing. And so um, I've also taken clients to their appointments, doctor's appointments, housing appointments, and things of that sort. And so I have completed 400 hours of internship hours. And so that's it. I just want to say thank you for listening to my presentation, for taking the time out, and have a good day.